Hello friends, in today's video we are going to learn about urinary tract infection. Urinary tract include kidney, renal pelvis, ureter, urinary bladder and the urethra. Infection of the bladder is known as a cystitis and infection of the kidney is known as a pyelonephritis. UTI is more common in female than the male because of shorter urethra in female. What are the causes of urinary tract infection? The organism, we can remember it like KIPS, KWPS is the mnemonic, Klebsiella, E. coli, Enterococcus, Pseudomonas or Proteus, and the Serratia. Among these, E. coli is the most common. Some atypical organisms which also can lead to the urinary tract infection are tuberculosis, chlamydia, trachomatis, and the candida like fungus. What are the symptoms which are seen in the urinary tract infection? Some patients are asymptomatic, some patient is having only urinary symptom, and some patient is having a urinary symptoms plus systemic symptoms. If patient is asymptomatic, then it is known as a asymptomatic bacteriuria. Urinary symptoms include dysuria, frequency, urgency, and the hematuria. Dysuria means pain while the micturition. Frequency means patient has to go for the washroom frequently. Urgency means patient is not able to hold the urine for the longer duration. Patient having a urge to go to the washroom. Hematuria means blood in the urine. Systemic symptoms include fever with chills, nausea and vomiting. In the serious cases, altered mental status also seen in the UTI, back pain and the flank pain seen in the pyelonephritis. If patient is having only urinary symptoms, then it is known as a uncomplicated UTI. If patient is having a urinary symptoms plus systemic symptoms, then it is known as a complicated UTI. Treatment for the uncomplicated UTI and the complicated UTI are different. What are the investigations which are required to diagnose the urinary tract infection? Urine report and blood report. Urine report include urine routine micro and the urine culture. In urine routine micro, we can see nitrites, pus cell and the leukocyte are positive. In urine culture, we can identify the organism and the sensitive antibiotic. In the CBC report, we can find the leukocytosis, high WBC count. In blood culture, we can identify the organism and the sensitive antibiotic. For the complication, we have to do serum creatinine. USG kidney ureter bladder, USG KUB. In the USG we can see bladder thickness, kidney size, kidney echo texture and corticomedullary differentiation. Now treatment for the uncomplicated UTI include nitrofurantoin 100 mg BD for 5 to 7 days, phosphomycin sachet or phosphomycin powder. A 3 gram single dose is enough, but for the phosphomycin the serum creatinine should be normal. The treatment of choice is the fluoroquinolones, ciprofloxacin, norfloxacin or the levofloxacin. The dose of ciprofloxacin is 500 mg BD orally or 400 mg IV BD. Norfloxacin dose is 400 mg BD and the levofloxacin dose is 250 or 500 mg orally or IV once daily for 5 to 7 days. We can give beta-lactamase like the amoxicillin, cephalosporin group like ceftazidime, cefixime, cefopodoxime like drug for 5 to 7 days. We can also give Septran means trimethoprime and sulfamethoxazole, one double strength tablet 2 times in a day for 3 days. For the complicated UTI and pyelonephritis, we have to give fluoroquinolones. Fluoroquinolones is the first line of therapy. We can give orally or IV. The treatment is ciprofloxacin and the levofloxacin. Ciprofloxacin is 500 mg BD with or without initial IV 400 mg dose. The dose of levofloxacin is 250 or 500 mg orally or IV once daily for 5 to 7 days. We can also give Septran, trimethoprime and sulfamethoxazole, one double strength tablet twice a day for 14 days. If patient is serious and not responding to oral therapy, then we have to give the intravenous ceftriaxone 1 gram BD. We can give extended spectrum cephalosporin like ceftazidime, cefosalbectam, cefoperazone and salbectam along with the aminoglycoside like amikacin and the gentamicin. We can also give beta-lactam plus beta-lactamase inhibitor like ampicillin salbectam or piperacillin tazobactam like piptaz. In the severe cases, we have to give the higher antibiotic like the carbapenem, which include imipenem, meropenem and the cilastin. Once the patient is stable and responded clinically, then we have to switch to oral therapy from the IV or parenteral therapy. But if the patient is more complicated and patient is having a previous history of pyelonephritis and we are suspecting microbial resistance in the patient, or patient is not improving clinically, then treatment should be guided by the urine culture report. This is all about UTI. I hope you would enjoy the session. Thank you.